Hi, James. Happy New Year.
Happy New Year. So good to be here.
It is actually very nice to be back. It is 1:56. Hopefully that's a 4-minute warning. I think we are waiting for Supervisor Wasserman to join us.
Happy New Year, everyone.
Supervisor
Happy New Year.
Wasserman, nice to see you.
There we go.
All right. It is 2 o'clock. I'm Supervisor Susan Ellenberg and delighted to call this first PSJC meeting of 2021 to order on, sorry, I have the wrong date in front of me. On January 7th, are we the 7th? Sorry. We sure are. And we are off to a rip-roaring start. January 7th, 2021 at 2 p.m. And why don't we start with a roll call, please, to establish the presence of a quorum.
Vice Chairperson Wasserman.
Here.
And Chairperson Ellenberg.
I am here as well. Thank you. Way back when we met in person, we did introductions and welcomes of everyone who sits on the dais with us. It's a little bit harder to do on the screen. I do want to recognize the newcomer to our posse this year, although he's not with us today. The Honorable Judge Ted Zainer is taking over for Judge Ryan as the presiding judge and representative on this committee. So welcome in absentia to Judge Ryan, to Judge Zainer. And we have somebody, Judge Beth McGowan is here today in his place.
Hi.
All right. Somewhere on the screen. Let's move right into public comment, please. Do we have any speakers today on public comment? This is the portion of the agenda that's reserved for members of the public who would like to address the committee on items not on the agenda, but properly within the purview of this committee.
We have one speaker.
Okay, let's set the clock for 3 minutes, please, Nancy.
Thank you. Our first speaker is Scott Largent. I am unmuting you. Please accept the unmute and you will have 3 minutes to speak. The timer will start when you begin speaking.
Hello, everyone. Good afternoon, Scott Largent. Happy New Year to everyone. Probably thinking this guy just doesn't give up. It's kind of hard to believe I'm the only person on public comment today. I don't think many people knew that a meeting was going on. I should probably send those out prior, but I just don't want to kind of crash your party and have too many people making public comment. I tried to go to I've been trying to do this for the last couple of months. I am self-represented in family court and the civil matters that I've been dealing with the city of San Jose coming after me for protesting. I need access to the clerk's office at the Hall of Justice. It's very important for me to pull criminal files. It's very important for me to pull information on dirty police officers. Example, like Officer John Tompkins, he arrested me several times, and he is somebody that was brought up on, I believe, 8 different felonies, a lot of really, really bad stuff. And this is important for me to access that. And that has been completely denied now at our courthouse. When you go up to the Hall of Justice, you have 2 or 3 deputies, and it's not necessarily their fault. It's court administration and the courts that are denying this. The Hall of Justice, with limited capacity, can fit 526 people in there. During COVID right now, I know things are kind of out of control, but you go down to Home Depot or Target, and those places are packed. So I'm concerned. You can no longer bring in a support person. You can no longer have an ADA accommodation. And it's just locking the public out. And I'm surprised that the public defender's office has not filed some type of writ or motion or, whatever they need to do to try to get access for the public, per litigant for stuff. I filled out a Faretta waiver for a case. I mean, I'm just wondering why I'm denied. It's very difficult. And watching the frustration of people trying to utilize our criminal justice system right now is just, it's sad to watch. I stand out in front of the courthouse. I try to interact with people and talk with them and just kind of get how they're feeling, because it's that disappointment at that door when you tell, grandma and you tell the daughter and you say, hey, you can't come in, no support people. And then you just send that person into, it's a scary environment sometimes. I am a little worried also. I was trying to file a complaint at the district attorney's office, and I'm wondering why there's no internal affairs for their investigators, why there is no oversight there, why they have no chest cameras, why they're not held accountable. I've wanted to file a complaint. I tried to attend the state of the DA's address at the county building, and 3 or 4 investigators blocked me at the door and said I was not allowed to come in. That was the day Mike Wasserman, we had a conversation right in the hallway, and I had told you that I was denied access to that public meeting is what I considered it. And it's just very sad. And I want to file that complaint, but I'm blocked from doing it. Something's weird.
That concludes your speakers.
Thank you so much. With that, then we will move to item number 3, which is approval of the consent calendar. Right now, there is just one item on the consent calendar. That's item 9, the minutes from the December 3rd, 2020 meeting. Supervisor Wasserman, do you have any changes?
No, I'd make the motion to approve the consent calendar, which is all of number 9.
Great, I will second it, but before we take a roll call vote, let's see if there are any public speakers on this item, please.
There are no speakers in the queue wishing to speak.
Thank you very much. Then Nancy, would you go ahead and do a formal roll call for this item, please?
Chairperson Wasserman?
Vice Chairperson Wasserman.
I'm sorry, Vice Chairperson Wasserman.
Well, that's okay.
And Chairperson Ellenberg.
Yes, thank you so much. That takes us then to item 4, which is to receive verbal reports from the departments on the response to the ongoing pandemic. And I'll turn to Martha, I believe, to walk us through those reports. And what I'd like to do is pause briefly after each department reports to see if there are questions from myself or Supervisor Wasserman. And then at the conclusion of all of the reports and questions, we'll go to public comment.
Thank you, Supervisor. With that, we'll start with DA Rosen, please.
Thank you. Good afternoon. Very briefly, the work of the DA's office continues. Of course, as I'm sure Judge McGowan will discuss a little later, the court operations are limited given the public health order and COVID. But nonetheless, there are various hearings that continue and cases that are being prosecuted, that are being resolved, as well as crimes being solved. So hopefully in the next few weeks to month, things will open up a bit more and we'll be able to handle more cases at the Hall of Justice. Thank you.
Thank you.
Are there any questions before we go on to the Sheriff's Office?
Not for me.
Thank you. Sheriff's Office, please.
And we'll come back.
They may be having technical issues. Do you mind, Supervisor, if we move on to Superior Court and then get back to the Sheriff's Office?
That's fine.
Thank you. Judge McGowan?
Thank you. Since the report out on December 3rd, the court has responded to the new regional order by again suspending jury trials to January 19th, though there will be a reevaluation next week as to whether jury trials will resume on January 19th. In addition, remote appearances are still being encouraged wherever and whenever possible. And the number of persons being admitted into the courthouse continues to be limited to those who are parties in litigation. Thank you.
Thank you. I have no questions.
With that, we'll go ahead and move on to Custody Health Services. Dr. Day?
Right. Happy New Year, everyone. And just a couple of things to bring to your attention. We're continuing to do bi-monthly testing for both our patients and our staff. For the employees, we've also extended testing to the Public Defender's Office, the District Attorney, and judges when we have a pop-up tent near the perimeter where the juvenile services and courts are. We also started a pilot program. It's a pilot launch of Abbott Binex, which is a rapid cycle test. And so we're doing the Binex now on all of our asymptomatic high-risk employees who have been exposed, and we're doing that for up to 10 days before they go into the perimeter. And so that's a pilot that we're doing, and hopefully once we finish the pilot, we're going to expand that across. We would like to start doing the Binex now on all of our employees every day. And so just with the stockpile of Binex now, Abbott Binex, we're making sure that we have enough supply to start that pilot, actually to start that across all employees. We also started a program with our patients to increase their participation in testing. We put together, a survey with the patients to see what motivates them, and apparently they're motivated by stamped envelopes. And so what we're doing is basically when they agree to test, we're immediately giving them a stamped envelope, and so that is increasing their participation, and that's something that motivates them to test. We've also restructured all of our team for COVID-19 to include data collection, reporting, tracking, a new template for how we have our huddles every day. And so that's going on as well. And then we also in December had a complete education campaign that was for probation, juvenile, as well as adults. We had video streaming. We did videos in 3 different languages and to include Spanish, Vietnamese, and English. And then we did a probation for the youth and did things in basically adolescent language that they could understand. A lot of this was around universal precautions, hand washing, mask wearing, social distancing, what all that means. So that's my report.
Thank you. Dr. Day, I do have a couple of questions, primarily around vaccines. Can you tell me what plans are in development for Custody Health to scale up to be able to vaccinate all county inmates?
And certainly, and we've been meeting, matter of fact, we had a meeting this week. We're putting together the structures for starting to vaccinate our patients. We're looking at that probably starting at the end of the month. And so right now we're putting together, tracking, how we're tracking the patients. We're prioritizing those patients by high risk patients first, looking at age, disease course, comorbidities, and track them based on those factors first in accordance with CDC guidelines. And so we're making sure that we have the staff in place to do that, tracking system so that when they're getting the Pfizer, how do we track that 28-day window? How do we track it, especially if we have patients that come in and leave before that 28 days to make sure that we have some handouts that they're leaving with information on how to get that second dose. So we're beginning to look at that now. We also have our vaccinations for employees. Our last day of vaccination for employees is tomorrow. And so we have encouraged, full participation in getting vaccinated. And again, with our employees, we have those prioritized as well. And so, and those were those face-to-face, those that have high exposure all the way down to administration. What we're going to do after tomorrow, which is our last day of vaccination, is that we're going to put together a survey to see what percentage of our staff participated in the vaccination.
Wow, thank you. That's impressive and thorough. And you anticipated some of the subsequent questions that I was going to ask. You said that you mentioned needing staff to administer the vaccinations. Do you anticipate needing additional people specifically for this purpose? Or can current custody health staff handle the vaccinations, and particularly with regard to inmates and the way you're prioritizing about how long will it take to get to everybody?
Right. And actually, we've been looking at that as well. And so I've been working with Valley Medical Center, Michelle Della, I forget the how's their last name. Anyways, and also I met with Mike Moreno and looking at contracts, and we're going to try to piggyback some of the contracts that they have. There's another vendor that I've used in the past, which is called Emeryville, and I've used them in the past. And so he's also going to take a look at that. And so he's emailed me back today with some contracts that are existing that we can tap into just to bridge having to give vaccination to our patients.
Great. And did you, I think you also touched on, but I didn't quite get, with regard to newly booked inmates, will they all be offered a vaccine upon booking?
We're looking at that. Supervisor Ellenberg, that was part of our discussion, and depending on what when they're coming in with their disease course, if they meet one of those priority areas, they'll certainly be dovetailed into that. But we are looking at perhaps giving that at the point of entry. And then part of that is to make sure that we would have the nursing capacity to do that.
Great, thank you. And finally, you mentioned that if people leave our custody after they've received the first dose, but not the second, that you'll send them with information. Will we be able to do any kind of form handoff to public health or any other service provider that can follow up with them and make sure that they have access to that second dose?
That's what we're working on now. We do realize that because we have a rapid turnover with most of our patients, that we're going to have to provide some type of information so that that second dose is critical for that second dose to happen within those windows, 28 days for Pfizer, and then I believe it's 26 for Moderna.
Great. When you have worked out whatever that plan is going to look like, I would appreciate just seeing an off agenda item that lets us know how that's going to be handled. Thank you so much.
Planning that this week because we were notified that our patients will start being vaccinated.
Got it. I really appreciate the report. Thank you so much.
So with that, it looks like the Sheriff's Office technical difficulties have been cleared up. Sergeant Menchaca?
Hi, how are you, Martha? And hello to Supervisor Ellenberg and Supervisor Washman. Excuse me. I wanted to go over our increase of COVID-19 positive inmates in our custody. I wanted to mention that on December 31st, we had 17, and today we have 111. That basically represents 5% of all inmates in our custody at this time. Also, I did want to mention as well the rapid testing that is taking place in our facilities. with our staff. And according to Custody Health, about 5 on an average per day are testing, and the staff is really appreciating it. And, basically what we do is we provide that option to staff that have been confirmed contacts, and they show up, they get their rapid testing, and it's done within 15 to 20 minutes. And if they test positive, they're allowed to go back and to their assignments and continue working. Other than that, we don't have.
I assume you meant if they test negative.
Oh, yes, I'm sorry. Yes, if they test negative, they go back to their assignments.
And I assume if they test positive, they're immediately sent home.
Excuse me. No, well, there is another test that is done to confirm that that is positive. And then, yes, they will be immediately sent home.
Okay, pardon the
They
interruption.
test positive on the rapid test. We do a nasal swab at the same time.
Yes. And other than that, that is the end of my report.
Thank you. I do have some questions as well for you, please. I've read and heard that the recent COVID outbreak among custody staff also reflects a number of staff members who were identified to have worked while symptomatic, often attributing their symptoms to something other than COVID. And I understand the temptation and the challenge. Extra help in custody isn't a realistic option, unlike in other departments, and bringing back retired sheriff's deputies brings its own risk, of course, since they tend to be higher risk, older adults. Yes. Nonetheless, this is a self-compounding problem, and clearly we just can't have it. Knowingly violating COVID screening and testing protocols, it amounts to reckless endangerment. I understand that currently the sheriff is sending home up to 10 members per shift. And of course, when staffing levels drop, lockdowns increase. So given this situation, I certainly agree that it's a priority that custody employees be vaccinated as quickly as possible. And I think, Renee, I'm happy for you to answer this, or it may need to be directed to Dr. Smith. Do you know when custody employees are expected to begin receiving the vaccine?
From what I understand, it's going to be about a week and a half to 2 weeks, but I don't have the exact date.
Dr. Smith, do you have any more specific information, or is that as good as we get right now?
Well, at this point, we're waiting for clarification from the state. We hope that it'll be within 2 to 3 weeks, but the state tier structure put law enforcement lower in the tier than we think they should be, so we need to get permission from the state to advance them in the vaccine structure. But we're quite well aware and pushing as hard as we can for it.
Thanks. I appreciate that. And in the meantime, what action is being taken, if any, against staff for knowingly violating COVID screening, testing, or other protocol, and how do we ensure compliance?
At this time, we are actively reminding staff of testing and making sure that they're in compliance, even if they do it at an outside testing site or with their own PCP, they still submit their results to us, and we input in our tracker. We have about an 85% compliance at this time. We have people out on vacation, people out, for different reasons. So we hope to actually, we focus and we strive for 100%.
Wonderful.
Which is terrific. That was slightly different from what I was asking,
though.
That's all right. Sometimes I'm clearer in my head. Consequences or accountability for employees who do come in sick or feel pressured to come in sick, or for whatever reason are just defying the protocols.
So at this time, we don't issue any type of discipline, or there are no consequences for the
Tell them not to come in.
Yeah, basically we just are strong in our language about not coming in. But at this time, there is no discipline for that or corrective action.
If we're made aware of it, then we investigate.
I don't know if that comment is supposed to be heard by us, but I can't quite hear it.
Oh, can you hear me now?
Yes.
Sorry.
What are steps that, I mean, clearly we need to be sure that leadership and supervisors are strictly enforcing the protocols, not pressuring staff to come in while they're sick. That of course, increases the risk for everybody. Can you share what steps leadership is taking to prevent and mitigate the situations, including maybe what backup options are under consideration to maintain staffing, such as maybe mutual aid agreements with other jail facilities to bring in staff from less impacted counties or anything else?
At this time, I don't have that information, but I will say that, at the beginning of every shift, there are temperatures taken. We make sure that they don't have the symptoms that are listed. We also check in with supervisors every day to make sure that staff is complying, obviously with coming to work with no symptoms. Other than that, I wouldn't be able to elaborate.
That's fine. I appreciate hearing that. Hang on one second, Supervisor Wasserman. I just want to wrap this up because I of course absolutely support people staying home. And if 10 or so each shift are testing positive, they must leave. But this must be creating significant pressure on the remaining staff. So that's why I was asking if there are thoughts or plans about how to supplement those absences in the short term.
Right. And at this time, I will say an average, because I take all those calls basically. It's we probably average about 3 to 4.
Oh, okay. That's
yeah. And so I have the advantage of actually being that person that takes those calls.
Good.
So,
then you're the one to ask.
Yeah. So it's not as high as 10, but I will say that, we do have staff that signs up for overtime, is willing to come in on overtime, and, be an asset, be a team player to the facilities in times like this.
Got it. Thank you so much. I really appreciate your walking through that with me. Supervisor Wasserman, you had a question as well?
I did. Thank you, Madam Chair. To the Sergeant, if I may, through the chair. What we've learned is approximately 60% of people who come to get tested and are found to be positive are asymptomatic. They don't have any symptoms. So the whole fever thermometer thing, while that's good on 4 out of 10 people that have COVID, it doesn't pay dividends on 6 out of 10. And so I would just suggest through the chair, you can do your due diligence with the thermometer. And if you have somebody with a fever, that's an obvious sign to go home. And I appreciate the fact that you tell all of your personnel, if you have any of the symptoms, to stay home, get checked out. But when a person's vaccinated, which according to Dr. Smith, could be a few weeks from now, things will be a whole lot better as far as that goes. But in the meantime, how often are the correctional officers tested?
They're tested every 2 weeks. Actually, some opt to be tested every week. It just depends on their interactions and close proximities to inmate population or, what they have going on outside of their work life. So they're tested average every 2 weeks.
Okay, could I, through the chair, please get the sheriff's response on, since 6 out of 10 people that test positive for COVID have no symptoms, what is permissible, what is allowed? I know there's a union structure and all that needs to take place. But if you test more often, you can catch the fact that somebody's positive sooner. Where are we as far as having weekly testing being mandatory, certainly until they're vaccinated? And then once that happens, which hopefully will be by the end of this month, you wouldn't need that. But what is in place or what is in play or what's being discussed as far as having weekly tests so that we can detect somebody who's positive much sooner than 7 to 14 days later.
Was that question for me?
Yes, Sergeant. It is, or whoever in the Sheriff's Department or Corrections, who's ever most appropriate to respond to that question. Again, that since we know 6 out of 10 people that have COVID have no symptoms, thermometer wouldn't show on 6 out of 10 people that are positive. The only thing that does show right now is the nasal swab. And when you take the nasal swab, you still have to wait a couple of days later to find out that the person is positive, and they've been around our other correctional officers and our inmates during that time. If they're testing only twice a month, once every 2 weeks, then they could have had it for 9 or 10 days. So I'm asking about the best thing we can do right now is increase of testing.
Right, I agree. You know, and a lot of that depends on our custody health staff. I mean, I know that they are short-staffed as well. You know, and it depends on, you know, how many tests they have. But I will say that the majority of people are getting tested every 2 weeks. They wouldn't mind getting tested every week.
And this is Dr. Day, and I can chime in, Sergeant, if you like.
Please.
Okay, and we are offering testing. We have a schedule for testing, Supervisor Wasserman. And so there's tests being provided several times a day, every day. And so at minimally, we're asking for twice a month. However, you can get tested as frequently as you can.
You can.
Or as you would like. But minimally, we're saying is twice a month. We're also, and I had mentioned earlier, when we're doing the Abbott Binex rapid test, we're doing that for those asymptomatic staff who have had high exposures, and that does include our custody officers. And so it's not just healthcare, it's custody officers as well. And we're also looking at the Abbott ID. This is another rapid cycle test, and it's another rapid test at point of care. And hopefully, if we get that in place, we will be doing that every day on all of our staff to include our custody colleagues.
Fantastic.
Okay.
Thank you very much.
And you get those results within like 15 minutes or so. But with the Abbott ID, if we put that in place, it's you can wait a little more in between, but that's what we're looking at.
Thank you, Dr. Day. So our correctional officers know they can get tested every week right now.
Absolutely. Minimally, we're saying twice a month, but I go every week. So.
No, as long as they know that, that's great with me. Thank you, Madam Chair.
Thank you very much. Martha, back to you.
Sure. With that, we'll go to Public Defender O'Neill.
Good afternoon, Supervisor Ellenberg, Supervisor Wasserman, and the rest of the committee members. I'd like to focus my COVID comments briefly on vaccinations, the topic of much of this meeting so far, and ask that the county prioritize frontline public defender lawyers and paralegals who've been in court really since March nonstop, often in crowded situations with clients who have masks that may or may not be new or a few days old. And because of our attorney-client responsibilities and confidentiality, we're very close to the clients that we're talking to, particularly in custody clients. And so I really feel that not all of our staff, but the staff that are in court every day and who are doing intercept out in front of the Hall of Justice should be prioritized as frontline workers. I got word today that Mendocino public defender staff was vaccinated. I know that Santa Barbara and Sonoma County public defender staff have been put in Tier 1B as essential workers. So I'm asking that the county prioritize our staff who've been in pretty precarious situations for months now and get them vaccinated. So thank you.
Thank you. Thanks for that, Molly. Dr. Smith, can you just add some thoughts there in terms of local discretion on tiers of vaccination? I'm actually a little bit surprised at what Molly said. I didn't realize that we had flexibility to create priorities locally.
We don't. We are still in phase 1A, and that includes healthcare personnel. And we've been told clearly from the state that they will have to tell us when it's okay for us to move out of Tier 1A. So public defenders aren't in Tier 1A, and I'll be happy to talk with Molly about what she heard from Santa Barbara or other places. But I do know there are a lot of rumors going around and lots of misinformation. But at this point, we're in 1A and we have not completed 1A.
Thanks. And Molly, I do hope that you'll reach out to Dr. Smith, and if you can share your sources with him and find out, with certainty that that's happening and under what rubric, if there's anything that we can do, then I'm certainly would be supportive of that.
Thank you. If I could, Supervisor Ellenberg, I imagine that because Mendocino is small, they may have already completed the vaccination of healthcare workers and those in long-term care. And so they've actually they've completed that and have moved on. And that's why it wasn't.
Okay.
But I do know that Sonoma County and the chief public defenders are communicating pretty much on a daily basis about what's happening in each of their counties. And of course, the moving parts include the number of doses received and the size of the jurisdiction.
Okay.
But for sure, Santa Barbara and Sonoma lawyer and public defender staff have been included as essential workers in 1B, not in 1A.
Okay, great. Thank you. Thank you. I appreciate the clarification. I have no other questions, Supervisor Washman?
No, unless we have a speaker, I'm good.
Okay.
Okay, it looks like we're moving on then to Independent Defense Counsel's office. Sylvia?
Yes, good afternoon, everyone. I would like to piggyback on Molly's comments, just to provide a very basic context. Obviously, our office provides the services of the independent defenders and that are appointed through the court. And like Molly's staff, our contractors provide essential work and have been doing so since the beginning of the pandemic. Even during the course of the court closures, they are providing the essential work to maintain some of the basic operational needs that are constitutionally mandated by the courts, and that will continue. And so I would like to be included in whatever conversation Dr. Smith has with Molly, because I believe it's my obligation to ensure our staff continues to be safe and included within that context as well. So that concludes my comments. Thank you.
Thank you.
With that, we'll go ahead and move on to probation. Chief Garnett.
Hi, good afternoon, Supervisor Ellenberg and Supervisor Wasserman, members of the committee. Hope you are all enjoying the new year. I have Deputy Chief Nick Burchard, who's going to speak to what's happening in our facilities right now related to COVID. Before he does that, though, I wanted to let you know about two fairly important updates. One, we were able to get the dashboard that you requested, Chair Ellenberg, on our website. It's on there as of today. It's not dynamic yet. It's still static, but we'll make it dynamic. So today, and it has cumulative and then current. So as of today, we have 6 staff with positive cases, a total of 59 cumulative. We have 1 active youth case, which actually was closed today. So we have 0 and a cumulative of 18, and we'll continue to show those 2 or those 4 numbers, the individuals and then the cumulative, pardon me, for both staff and youth. So that's one thing that's exciting. And the second is specifically regarding vaccines. Our probation officers are going to be, at least I think they are, that's the plan. Moving forward, we're going to have a few probation officers that will be assisting in the vaccination arena and helping in any way we can, and the whole all hands on deck. I mean, just to the point that people are making, we're a huge jurisdiction. There's a lot to be done. If more sites can be opened and we can assist with that, then we're more than willing to do so. So we're in conversations today with folks setting those sites up and with our union, and have really good buy-in and are happy to be able to help. And with that, I will turn this over to Deputy Chief Burchard, who's almost a doctor now by my calculations.
Not the kind of doctor I would want to be hearing all this COVID information, but it's kind of what we do right now the past 10 months. I don't have a lot to update other than what the chief mentioned, which was, I think, really important. Other than she mentioned that as of today, we have no COVID positive cases with youth at both Juvenile Hall and the James Ranch, which is really encouraging. We do have some staff that are out, and she mentioned the numbers. As far as the testing goes for us, Chair Ellenberg, we're also part of that 2-week testing as well, and we've had as high as 95% testing rate on that 2-week process. And so I think we've come a long way, and our staff are certainly very concerned and want to know where we're at. I think certainly the spread in the community has really hit everybody. And so people are wanting to make sure that they're safe. And so the testing is really, I think, going well. And if I have any questions, I can answer.
Thank you. And thanks, Chief Burnett, for letting me know about the dashboard. I was going to ask about the status, so I'll be sure to take a look after the meeting. Thank you. I do have just a couple of questions in regard to the juveniles. What is the process that's in place for informing family members of their child's quarantine status or of any outbreak, active outbreaks in a facility?
Yeah, so we make a point anytime that we find out, let's say that there's a youth that's positive, we work with our custody health doctors, and we immediately huddle any day, time or night that we find out this information, and on weekends, and craft a plan. We immediately contact the parents by telephone to inform them that either their child was positive or is a positive that may have had an exposure. It could have been an exposure to another kid or to a staff. So we update them as soon as it happens.
And what about when a child enters the facility? Do we inform the family members of the COVID protocols?
Yeah, so the protocol is every youth gets tested, and if a youth is positive, we will immediately call that parent as well to let them know that they've come in from the community, and then public health does that follow-up and reaching out to the family to make sure that they're okay and testing the rest of the family members. So that is a part of our process.
Okay, thanks. I understand that there have been a number of parents who felt that they didn't get information when they need it. So I'd like to ask that the department work with County Counsel just to ensure that family members receive timely information on the status of COVID in juvenile facilities, as well as the quarantine status of their own children that's in compliance with HIPAA, please.
Yes, certainly. And one of the things we did do, because we heard some of the same information and concerns, is we went ahead and sent out a notification and a letter to every parent of a kid in custody here at the James Ranch, just explaining the process, explaining the services that are still being offered to their youth. Here's what happens as far as the testing process for our staff, the youth, just to keep them informed to the best that we can, because sometimes the kid, that's not the conversation they want to have with their parents when they see them or have that telephone contact or their Zoom contact. So we want to make sure they're informed.
Great. Thank you so much. I appreciate that, Nick. Supervisor Wasserman?
No, I just have a question at the very end.
All right. Martha?
Okay, with that, we'll move on to reentry services. Javier?
Good afternoon. Happy New Year, both Supervisor Allenberg and Supervisor Wasserman. Just very pleased to announce that starting this month, we have evening hours at the Reentry Center in San Jose, and the first Saturday of the month. So on every Tuesday and Thursday, we're open from 5 p.m. to 8 p.m. And then the first Saturday of the month, we're open from 8 a.m. to 12 p.m. For this month, we'll be opening open on Saturday, January 9th. So very pleased to have additional hours for clients to come in the hours. So we spread the hours over the week. And those services are only for client registration and service triage, and we'll be referring clients to services. But the important thing is to make sure that the public knows. And so we did update the county's website. So under the COVID-19 updates, it's reflected there that we're open on 2 evenings during the week and 1 Saturday a month. And then lastly, wanted to give this committee an update. We're onboarding 2 community workers, extra help, that are going to be part of assisting with the CAPS and GROW program, and then also helping us with the evening and weekend hours. So we got great applicants, and we are onboarding 2 with lived experience, and those 2 individuals also attended our San Jose City College Peer Mentor Certificate program. Thank you.
That is a lot of good news. Thank you. And it looks like you've got beautiful art behind you, Javier.
Thank you. It is a poster that was designed by women in custody 2 years ago. So it's a poster about Reentry Center. Thank you.
Nice. Thank you so much.
With that, then, our final speaker on this item is Matt Fisk from Pretrial Services.
Good afternoon, and thank you for your time. We don't have anything new to report other than drug testing. We're providing all services through Pretrial Services on the normal business schedule.
Thank you. Supervisor Wasserman, do you want to make your comment now or after public comment?
After public comment, thank you.
All right. Reconfirming, Martha, that concludes the reports?
Correct. Thank you, Supervisor.
Great. Thank you so much. Nancy, do we have any public speakers on this item?
We do. I see one person waiting in the queue.
Okay, let's set the clock for 2 minutes, please.
Our first speaker is Scott Largent. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. Good afternoon, everyone. I fully agree that we need to, our first responders in a way that are really, really in the trenches, you know, like the 3 or 4 deputies that stand out in front of the Hall of Justice and direct everybody into the right, you know, what they need to do, where they need to go. You know, they're touching paperwork, they're right in front of people. I sure hope they were first on the list. And then in the beginning of COVID, Damon Silver was right out there in front of that place, you know, telling people what they need to do, blah, blah. You know, I hope he got a vaccination right away. I hope the 2 or 3 attorneys that stand out there with that table right there, I know I criticize a lot of these people, but I mean, come on, they're right there in the front. And then at your county building, the good people that work there that sit at those tables and screen people as they're coming in, they have not gotten the vaccine. I know that for a fact. This is kind of weird. And I do think the attorneys need it. And I mean, of course, everybody needs it, but these people are right in the front. And can somebody please check on that little old Asian lady that's just sweet as can be, that was cleaning the COVID death bathroom in there? Can we make sure she's okay? Has she been put on leave? Is she still alive? I mean, I like that woman. I got to know her over time of just her just being sweet and nice and letting me put my bike in the hallway and checking in on me. And this poor woman had to show up there at 4 or 5 o'clock every day and clean a bathroom that was absolutely destroyed. And I just hope she's still around. I'm hoping you protected her and listened to the public when they kept speaking up. I hope she's okay. You know, I have to know a lot of these people. It's just kind of sad. Remember who's right at your front door helping. Okay, thank you.
And that concludes our public comment.
Thank you very much. Do we need a motion to approve these reports?
I'll be happy to do that. Then I have a comment to make. A motion to approve.
Second.
May I make my comment, Madam Chair?
Please do.
Thank you. Thank you. Yes, that janitor, Daneta, she's an absolutely wonderful woman. I've enjoyed speaking with her as well, Mr. Largent. Couple of things I just thought I'd throw out here because we've got 25 to 30 people. Some information that's a little different from what you hear out in social media or the media in general. But as of a couple of days ago, Santa Clara County had received 120,000 vaccines. And we had distributed, we'd received 150,000. We distributed 120,000, which is 80%, which is far better than what's going on throughout the state, throughout the nation. You know, you hear numbers like 30%, 40, 50%. Santa Clara County is up 80%. And Santa Clara County, as Dr. Smith said, must follow the state orders, and they have these tiers, 1A, 1B, 1C. And what they're designed to do is to protect those caregivers who are giving care to people with COVID, because they are in daily contact with somebody that we know has COVID. Otherwise, people we test, I don't know, somewhere around 3-4% of the people we test show up positive, and half of them, 2 out of the 100, are asymptomatic and have no side effects from having it. So as much as I would like every one of us to be vaccinated tomorrow, especially my 88-year-old mother who hasn't been vaccinated yet. But as much as I like everybody to be vaccinated, what the state's trying to do is vaccinate those people that work with people with COVID and vaccinate the most vulnerable people. So the people in long-term care already with a comorbidity, if they get COVID, their death rate is over 10%. It's between 11 and 12%. That's where stuff is going. And I just wanted all of you on public safety and justice, if you already didn't know that information, perhaps you knew all of that, perhaps you knew part of that, perhaps you knew none of it, but it's very, very important. Bottom line, we are getting out more of our vaccines faster than any place else, and we're giving them per state regulation, state rules, to the people taking care of COVID people and the people most likely to die. And we need to stop the deaths, and the people that are dying are the ones that go to the hospital. And speaking of dashboards, Madam Chair, as of right now on our county dashboard, it says that 98% of our standard capacity ICU beds are occupied. 98%. And we're still waiting for an additional surge to come in 3 to 4 days from those people who didn't follow the rules during New Year's Eve. So we're going to get down to zero. That's going to happen in the next few days. And we'll be giving out vaccines as fast and furious as we can. And hopefully, if we can get up to giving out 10,000 vaccines a day over a 120-day period, a 4-month period, we'll be able to give out 1,200,000 vaccines, which should qualify as herd immunity to all of those that are 16 years of age and older. So I wish all of you good health. I'll get off my soapbox now, but I think you having this information and being able to share it with others is very important and very relevant to the conversation tonight, because I wish each and every one of you and each of the people that work for you could get the vaccine tomorrow, but this is why they can't. Thank you, Madam Chair.
Thank you very much. Well said.
Thank you.
We need a roll call vote, please.
Sure. Vice Chairperson Wasserman
Aye.
and Chairperson Ellenberg.
Yes. Thank you so much. With that, we'll move on to item 5, which is a report from the District Attorney on a gun-related intelligence program progress report.
Thank you very much, Supervisor Ellenberg. I'm going to introduce now Assistant District Attorney James Gibbon Shapiro, as well as Supervising District Attorney Marissa McEwen, who supervises the GRIP program in the DA's office, the gun-related intelligence program. And I'm going to turn it over to them in just a moment, but it's really my pleasure to inform the board that GRIP has become a regional leader in gun violence analysis and collaborative solutions. Essentially, the core of the work is linking shooting scenes through ballistic and firearm analysis. And in addition to looking at shell casings, the GRIP team fuels a collaborative program with the San Jose Police Department in targeting priority gun offenders. And the program has resulted in the arrest of dozens of prolific gun offenders and the recovery of hundreds of crime guns. The mission of GRIP is gun violence reduction through collaboration and intelligence sharing. Through its innovative work at GRIP and the DA's Crime Strategies Unit, it's a critical center in analyzing, number one, what kind of gun violence exists in our region. Number two, who is involved in that illegal activity. And number three, what local and federal resources are best suited to address that issue. So with that, I'm going to turn it over to James Gibbon Shapiro and Marissa McEwen.
Marissa McEwen, if you could load up your presentation, and there we go. Take it away, Marissa.
Hi, I'm so honored to be here to talk to the board, and thank you for the support that you showed earlier this year in founding a county gun team. And so really this is a report out on what was formed in our county and how we're really a national leader at this stage. And I speak nationally with my colleagues in this type of work. This type of work is known as a crime gun intelligence center, which means a program that is evidence-based. It starts from the ballistic evidence, but it also incorporates a holistic and multidisciplinary approach to driving down gun crime. You may know that during COVID, in spite of many different categories of crime going down around the country, shootings and gun possession have been hugely up, and that's very concerning to us in this county, as we're seeing a similar corresponding increase in our region. But we're here to do something about it, and we have a team in place to do that. So at its core, the GRIP team consists of the following employee structure. I supervise the unit, but really it's this dream team beneath that fuels all the projects. The board authorized hiring a lead intelligence analyst and 2 intel analysts. Those are grant-funded positions that really are the stars of the show. They do a really important crime analysis that we'll highlight in a moment. We also have a gun attorney that's been dedicated just to doing gun-specific work, and we'll talk about that. And these are not average cases. These are large-scale gun trafficking networks. This is specialized built AR pistols that are being built in garages. So we'll talk about some of that work. We have a DA investigator and an intern program. And then we're very grateful that the San Jose Police Department has an official program and liaison for us, a sergeant, to officially acknowledge the work and the partnership that we have with them. But it's really the strength of our network that leads to our success. We couldn't do this by ourselves. I am not a police officer, nor do I seek to be. I'm a prosecutor. And what our goal is always to work with our partners to identify people who are ripe for prosecution of actual crimes being committed, not just your average other type of crime, but specifically people are driving major gun violence. So we work with a Western Crime Gun Working Group in Nevada and Northern California. We sit on various committees, including one with Public Health and the Department of Behavioral Health, to try and address gun crime, suicides, and domestic violence related gun crime and restraining order rollouts. And we have education campaigns through that. And then, of course, we have federal partnerships. But really, it is our partnership with the Crime Lab that started our work and fuels a lot of the information and intelligence at GRIP. And that's because of linked shell casings from shootings. So we'll talk about that in a moment. But our goal is to identify 3 types of threats: person-based, place-based, and problem-based. We don't just work on identifying specific priority gun offenders, although that's a large part of what we do. We also are trying to identify the neighborhoods that are most plagued by violence. It's a very large county, but gun violence, incidents of shootings, homicides, aggravated assault with a firearm, and then robberies with a firearm are concentrated in certain neighborhoods. Not surprisingly, these are often neighborhoods that also have victimization and crime rates above the county average. And we look at that, we monitor the trends and where the violence is happening to help create community-based solutions with our partners. And then problem-based. So if there's a new trend happening in the county, such as during COVID, we've seen all kinds of problems with an increase in kit-built guns being built at home that subvert the registration process and background checks that we have in California. And we've worked very closely with various different groups to try and monitor and track that and curb that industry. So our Priority Gun Offender Program was highlighted actually earlier this year when myself and Deputy Chief Randall and the board were reviewing the county gun team. And really it was a commitment from San Jose Police Department to attribute some of their teams to help go and do things like the execution of arrest warrants for known gun offenders that were languishing for some time. But mostly it's to identify gun builders, gun trafficking, and large-scale gun crime, not just the one-off gun possession case. That is not the target of the specialized gun team. So some examples that we had very early on is that you'll discover a NIBIN link or a ballistic link between shootings at the crime lab. You'll then look more closely at the series of 5 to 10 linked shootings and quickly identify that there is a group of 1 or 2 offenders who are driving that violence. We then work to reopen old closed assault cases with the police department, and then to have an apprehension team once we file a case, safely apprehend and prosecute these cases. It's all intelligence driven from 3 different types. Evidence, meaning the shell casings or the actual ballistic evidence at the scene. investigations and follow-up that we need to coordinate with our law enforcement partners, and human intelligence that we gain from our partners in law enforcement, from some of our defendants, and the various partnerships and networks that we've built in this program. But to give a recent really dramatic example, we have a multi-jurisdictional, now multi-state gun trafficking network that was exposed because of the work at GRIP, because of the partnerships that we formed. One of my colleagues, a prosecutor in San Joaquin County, reached out to us knowing that we ran the gun intelligence program here and said, hey, we know of a particular offender who's come up in a wiretap case of ours who we know is trafficking guns from Arizona by and through Santa Clara County. What can you do to help? We immediately mobilized a network to try and prosecute and identify this case. And it's now led to a massive, large-scale, multi-state, federal and state investigation that we've prosecuted in our office, along with San Joaquin County, San Francisco County, and now Alameda County, all have open cases related to this network, and we couldn't have done it without this team. It required the infrastructure and mobilization of resources that was above and beyond what had existed prior to this unit being an infrastructure for this size of case and the complexity of the type of case. So what do we specifically do? When on person-based, we support apprehension, we file the case, we assign and assist vertical prosecutors to file these cases, to ask for special orders, things such as ensuring that they don't have other registered firearms, ensuring that if they need special services, if they're released on bail, that we coordinate with our various partners to ensure that that's done safely. But mostly we are the central place in our office for sharing this information that's developed by our analysts and our partners so that everyone is better informed about who is actually driving this gun crime. We actually provide that information to the court in support of bail motions, in support of our prosecutions, and it overall improves the quality of our prosecutions as a result. Place-based, this is some of the work that I'm the most proud of, which is that when we identify a neighborhood that's being specifically plagued by gun violence, we develop operations to try and solve that, but it's not just through law enforcement action. It's through community prosecutors going into these neighborhoods and working with community groups to help them. It's by going into certain apartment complexes and helping support through, again, our community prosecutors or other resources on the committees we sit on to address that issue. And finally, problem-based, like I spoke of, ghost gun builders. We did a couple operations this year to interdict specialty items such as Glock auto switches, which turn handguns into machine guns, or silencers that were being imported from China. So we worked on executing search warrants to try and get those weapons back, and it led to quite a few dramatic cases that were overseen by our unit. And then we deploy available resources. So here are some examples of some products that we've done that have been part of our criminal cases. We do crime driver workups to assist our prosecutors. These are discoverable documents that are given to the court and our defense partners so that we all can have in front of us a centralized place where we can see the history of the gun-related crime. This is a little snapshot of a density map or a heat map that we do on a monthly basis to look at where are the new hotspots of gun crime so that we can then identify emerging trends and areas that may need specialized resources and attention. But this is an example of an analytical product that without this kind of link charting, we did not understand the interconnectivity of all the shooting sprees. So I know you can't read all of this, but what it shows is multiple shootings that are overlapping that we learned because of the ballistic evidence. And it turned out that it was several in common back and forth shooting sprees over a very finite period of time in one neighborhood in San Jose. And until we put that together, even the investigators didn't realize they were all related. It led to multiple prosecutions across our office. And it also led to some increased resources for this particular neighborhood. We obviously work to solve more shootings through our crime lab, but also we worked very hard to change the internal policy within our county for how guns are submitted, processed, and handled in our county. It didn't used to be that every gun went to the crime lab, and now it is, but that required a massive infrastructure to support. And without our analysts, literally the NIBIN leads would be going nowhere. So we're really grateful that we have this massive database behind it and analysts to read it. We manually enter every single linked shooting. And then we have an infrastructure behind it to support and track all of these cases. We have a weekly meeting where we discuss all of the linked cases. And then we have to link up with prosecutors and cops and probation officers and pretrial services sometimes to try and take subsequent action. Our gun prosecutors help in court to coordinate relinquishment hearings and get guns from prohibited persons. And we also have a weekly federal call with our federal partners to make sure that we deconflict and share information. So recovering illegal guns requires getting warrants for armed persons, addressing armed prohibited persons. All of these programs that you see here, including restraining orders and probation relinquishment, are individual massive programs that are overseen by our analysts and our prosecutors, which if we had an hour, which we don't, we have 10 minutes, I would get into, but all of these are independent programs that are run through our unit. And education campaign, engaging stakeholders and reporting out. We put out periodic reports from the Crime Strategies Unit. We have an annual report. We have reports that we've written for each of our districts. We are regularly trying to put data out for our partners so that all of us can be better informed about where the gun crime is happening and who's doing it. And I'm constantly putting on education for the public, police, and prosecutors, for example, on gun law updates and gun violence restraining orders. So when we started in 2017, there were 115 total linked agency cases. That was our first year of existence. In 2019, our total number of linked cases was more than double that. And I don't have our complete year-end totals for 2020, but we'll be well over 200 by the time they're all tabulated of the number of linked shootings. So among those, that was 10 linked homicides with a NIBIN lead. And without, like I said, the analysts to support that, they would have been going nowhere. We wouldn't have known that these cases were solved and linked and prosecutable. And we're making progress slowly but surely. We put up some fairly alarming numbers on the steadily increasing gun crime from 2006 through 2018. But in 2019, we did see in our first year of really pounding the pavement with grip that shootings and robberies with a firearm went down. We're not going to claim sole credit for that. I think crime trends and stats they don't work like that. But I will say that we're hopeful that the collaboration that we have with our partners means that we're making steady progress to identify gun offenders and that we overall will have an impact on gun crime. Just take a look quickly at some of the updated numbers from San Jose PD. In our partnership with Priority Gun Offenders in identifying and seizing firearms, in 2019, they seized a total of 55 firearms. But after we went live in February of this year with the PGO program, Priority Gun Offender Program, they seized 236 weapons, which was a 329% increase. That was through a series of operations they did with our unit. So those are intelligence-driven operations. This isn't just car stops anymore and hoping to get lucky. This is going after, like I said, interdiction on imported silencers, going to the garages where AR-15s are being built illegally. These are major gun traffickers. So that's the kind of gun crime that we are hoping to make a major impact on. And we do that only through our partnerships. So as Chief Garcia often likes to talk about, teamwork makes the dream work. This is one of his tweets from earlier this year that I am happy he's touting, but in 2019, officers took 386 illegally possessed guns off the street. And in 2020, as of September, they were at 521. By year's end, we're expecting that to be over 700 guns. So a massive increase, almost double the amount of seized firearms from last year. That's no accident. That's because we are coordinating and sharing information, getting smarter about how we prosecute gun crime and how we investigate. And that has to be supported by an infrastructure of analysts and intelligence. So this evidence-based program we're very proud of, and we're grateful to the county for allowing us this opportunity.
Oh my goodness. Marissa, thank you so much. That was a tremendous report reflecting clearly an incredible amount of work and partnerships. I really want to offer my congratulations to you and to the entire team on this very positive first year. And thank you so much for sharing that with us. Really, really impressive, exciting work. Supervisor Wasserman, do you have questions or comments?
I do. I don't know if we have a speaker or not. I'd like to do it afterwards if we do.
After public comment? Please. All right, absolutely. Nancy, do we have public speakers?
Yes, we have one speaker at the moment.
All right, 2 minutes, please.
Sure. Our speaker is Scott Largent. I am unmuting you. Please accept the unmute, and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. Good afternoon, everyone. Scott Largent. I had spoken about the firearms relinquishment process through civil court, through family court, at many of the domestic violence council meetings. I thought it was very strange that no one came to my home and asked me about my firearms. I was pretty open and honest about this stuff. I look over some of these civil orders, and it just seems like something was missing right there. At the point that I originally got sober, if somebody showed up over at my grandmother's house to follow up on things, I would have given them those firearms immediately. It's just kind of strange. And I know on some of the court paperwork, I'm kind of reading over it. There's sections where you can click, does the other party, own a firearm, or, what if they just don't know? A lot of firearms that were in my family were, my Uncle Lloyd's. He served in the Korean War. My father that was a Vietnam vet. I mean, just imagine the amount of guns that families can accumulate over time. And most of the time they sit in a safe. Father owned a business. He had a firearm at work, but this stuff was under lock and key most of the time. Why did nobody ask? And hopefully now you guys have figured out to do that. My other firearm that was stored at the sheriff's department has been destroyed. There's a policy, I guess, if they have something too long. I will never be able to get that firearm back. But where's the follow-up to figure out what I did with the other firearms? That's what's kind of weird. They were all registered to my father. You guys could have done the homework. I'm not a criminal, but I'm just wondering why the T's are not being crossed and the I's aren't being dotted. It's just kind of weird. I just don't think follow-up on just a little level. I just think it needs to be there. People do the right thing. They'll turn their firearms in. They'll cooperate right away. I just continue. So thank you.
That concludes our public comment.
Thank you very much. Supervisor Wasserman, please go ahead.
Thank you, Madam Chair. Marissa, thank you for your report. I've enjoyed them each time I've heard them. I think what you're doing, and James Given Shapiro and the whole DA's office, is absolutely tremendous. I would ask through the chair to our DA, Mr. Rosen. I got the PowerPoint presentation at noon today and wasn't able to look it over prior to this meeting. It starting at 2. If at all possible, next time we receive any kind of PowerPoint presentation from your office or any one of the other 20 offices represented today, if you can get it to us a little bit sooner, I'd have time to look it over and may have some questions. But I enjoyed following Marissa and the data. I also think, Mr. Rosen, that I read the example that you gave in our, I'll call it staff report, in the ledge file. And I thought, what a great TV show that would make. On NBC, Grip. The name is great. Each week would be a different case that you did. I just think, starring James Given Shapiro and Marissa. Anyway, I just wanted to throw that out, Madam Chair. I think there's a future out there for a couple of these guys. and Marissa. Is it McCowan or McEwen?
McEwen.
Thank you. Thank you, Madam Chair.
Of course.
Never know where this is going to go. Thank you very much.
The name's great. It's just the whole grip.
Awesome.
I promise you that the meetings are worthy of a TV show. The cases there's no shortage of interesting casework out there, and they are each fascinating.
And totally different than what's on there now.
Yeah.
Well, now you're going to have to figure out who you want to play you in the movie.
I would like Sylvia Perez McDonald to play me in the movie.
There you go.
Oh, goodness.
Marissa, I was actually going to ask, please let me know when you're back on when the movie comes out, because I wanted to see you on big screen, but thanks for that.
There we go. Good.
So many hidden talents. Loving this. Thank you, Mike, for introducing that. Do we need a motion to receive this report?
No, ma'am.
We do not. Then we will move on to item 6, which is a Behavioral Health Department report on the establishment of dashboards for criminal justice services. And I'll turn to Sherry.
Yes, good afternoon, Chairperson Ellenberg and Supervisor Wasserman. We have a couple of our team members who will be presenting today. Gabby Olivares, our Division Director with our Criminal Justice Services. Brian Wagner, our executive over analytics and reporting, and Todd Landrino, our deputy director. So Gabby, I'm going to go ahead and turn it over to you.
Thank you so much, Sherry. Good afternoon and Happy New Year, Supervisor Ellenberg and Vice Chair Wassenberg, and Public Justice and Safety Committee members. Thank you so much for this opportunity to report out on some of the amazing work that we're doing within behavioral health. As many as you know, we launched a new electronic health record September 1st, my avatar. So as Sherry stated, we're here to report out on the dashboards that have been created by extrapolating data from our new electronic health record. So just to kind of provide some background information really quick for you all. This information is gathered by clinicians that work in Department 60 and 61. When a client comes to court, the behavioral health team will conduct what's called an integrated justice services screening. The screening is conducted with the client as part of the service enrollment process. So every client that comes before us in Department 60 and 61, we do a screening to look at their level of care need. The data is used to determine an individual's treatment plan. We generate the appropriate referral based on the responses that the client has provided to us. We collect an array of data that includes but not limited to the client's ethnicity, gender, referral source, referral site, level of care recommendation. We also look at insurance status. If someone does not have insurance, we still gladly provide them services. We ask about their language preference, when they will be leaving custody, what is their living situation, and if we can go ahead and start working on preparing living situation arrangements so that they can leave custody with either going to a shelter, a transitional housing, or one of our residential programs. We also coordinate carefully with the public guardian's office if somebody is concerned. As the data is gathered in our electronic health record, the dashboards can be organized to look at data reflecting our daily census, the number of clients that we screened and referred into services, and where we referred them to once they left custody. So just let's quickly review the first dashboard, which the data capture is a small set. It's on September 1st through November 15th. So if you can see during that period of time as we were still transitioning to our new health record, we did a total of 189 assessments. Part of our assessment process is to look at if this is a diversion case. So 187 of those cases were not diversion cases. They were just regular cases going into community. A very small percentage, only 3 clients were considered what we call incompetent to stand trial, which basically means that they were not on the, they were not going to state hospital, but they were just going to release into community. And also during that period of time, we only had 1 client that was concerned. So as we're looking at our dashboard, you can see here that we look at basic demographics that we collect. So before you see gender. So the majority of the cases that we screened that period of time, 76% were male. The next window shows you ethnicity, where we have the ethnicity broken down of the populations that we served. Next was our language category. The majority of our clients were English speaking that we served. You'll see that it says no entry. So sometimes because of the clinical state of someone, we know they speak English, but we document what they tell us. And if someone does not, have a language preference, or they don't want to say what it is because maybe clinically they're not doing well, you'll see sometimes we have no entries in some of our referrals. Then we have our referral source. So as you can see, the majority of our referrals from that period of time came from Department 61, which is Judge Manley's court that we support. The next slide, you'll see it says referred to site. So these are all the different sites in the community that we've referred to in that period of time. Next is living situation. So again, we will ask people if they need accommodations, do they have somewhere to go once they're releasing from the jail. So a small percentage were released maybe back to their parents, or they were renting an apartment with somebody. But the majority, as you can see, 48% are homeless. And then 51%, we have other sources of housing, shelters, temporary situations for our clients. Then you'll see the level of care recommendation. Basically where did we release them to? An intensive program, an outpatient. So these are all the different referral sources. And then insurance type, the majority of our consumers have a Medi-Cal benefit. Next slide, please. Okay, so our second slide is a combination of our severity ratings. So during our process, we compile a severity rating. We have 6 categories that are based on our assessment. The criteria is based on the American Society of Addiction Medicine. And the 6 criteria are: 1, acute intoxication and withdrawal process; 2, biomedical conditions and complications; 3, emotional behavioral health or cognitive complications; readiness to change; relapse, continued use; and recovery environment. So we take a severity rating, for example. One question we'll ask is, once you leave custody, what is your environment? How would you rate it? What's the severity of your environment that you would be rating? Is it a very high risk environment? Is it stable, moderate, mild? We will ask the client. During the screening process, we take a strength-based multidisciplinary approach where we consider the client's needs, obstacles, strengths, assets, and resource to support the client as they leave the jail and recover in community. It is the most widely used comprehensive set of guidelines for placement, continued treatment, or if we need to upgrade someone into a higher level of care. So just in closing, behavioral health would like the ability to continue to evaluate trends, gaps, and look at the client's greatest clinical needs to help us to continue to plan programs or adjust our programs to meet the target population needs. Thank you.
Thank you so much. I think, can we stop this screen sharing? Thank you. I want to just start by expressing appreciation for the tremendous efforts to roll out this critical effort during a pandemic, no less. It's really exciting work in progress, and I look forward to seeing how the data will inform policy that best serves this population. I think there's a lot of opportunity to partner with the Board of Supervisors on behalf of our community. And I would just at this time like to request a report back to this committee with another update once the CBO integration is complete, and hear about next steps. Thank you so much for the work.
Thank you,
Supervisor Wasserman.
No, ma'am. Thank you.
All right. It occurs to me that I have done a less than stellar job during this meeting looking to other members of the committee or the virtual dais. So I'm going to ask Supervisor Wasserman to help me going forward during virtual meetings to keep an eye on the blue raised hands so that I don't miss people who want to weigh in with undoubtedly valuable comments for us. And my apologies if I did miss you earlier today.
You got it.
Do we have public speakers on this item?
Yes, we have one speaker in the queue.
All right.
Next speaker is Scott Largent. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, everyone. Scott Largent. It was interesting listening to the gal from behavioral health talk about what happens after they get out of jail or what these next steps are. Currently, right now, no homeless shelter. I'm sorry, the Armory in Gilroy is the only place that's accepting people in right now. So there's no shelter these people are going to when they're getting out of the Santa Clara County Jail, when they're leaving the reentry network. They basically do the, it's not necessarily like a walk of shame, but they turn left and they go down to Spring Street. They go down to Hell's Kitchen down there. There's no services down there. It's just insane. And I cannot keep beating a dead horse. Behavioral health in Santa Clara County is just a goddamn joke, okay? You cannot run a behavioral health system from home. That entire location is a ghost town right down there. That entire parking lot is empty. There's no social workers out there at St. James Park. There's no people helping, talking to people. I don't even see a county van. Stop being scared of these people. And you know, I mean, you guys need to get out there. They need to talk to somebody. They need to know where to go. They need to know where the restrooms are at. They need to know where they can get water at. And they need to learn how to survive in an environment right now that is brutal towards these people. And it's a humanitarian disaster down the street from the county building. You guys should be talking about that at these meetings. You should figure out how to help these people. And it's sad what you're doing to your employees, because everybody comes down from Spring Street, the FAA crash zone, and they go use the county facilities. They use the bathrooms. They go into the PD. They go into the sheriff's department. And just think, if people were sick, why not have washing stations right out there in front? Why not have adequate bathrooms? You guys don't have any of that stuff. They pulled the Porta-Johns out of the San Jose PD's parking lot a couple of days ago. There's a passcode on the sheriff's bathroom. And after 5 o'clock, you better get a bucket.
That concludes our public comment. Chairperson Ellenberg, you're on mute.
Thank you very much. Supervisor Wasserman, any final comments or motions on this?
No,
this
ma'am.
item?
Enjoyed the
All right.
presentation.
Thank you. We'll move to item 7 then, which is a verbal report from me regarding the 2020 and 2021 study sessions. Just as a quick recap for all of you, in 2020, we explored the following topics during special study sessions. We explored, along with the Office of the Sheriff, Custody Health Services, and Office of the County Executive, the well-being, training, and supports for our custody staff. We engaged in an informative discussion of the intersectionality of criminal justice and mental health, including a discussion of departmental policy and procedural changes to accommodate best practices, and a presentation on the mental health court. Our third planned session was to be a study of the substantial spike in the homeless death rate over the past few years of individuals who had had recent contact with the criminal justice system. We were set to explore ways in which our interactions with these individuals and their time in our system may have hastened their deaths, and use that information as an opportunity for an intervention and improvement in our systems that would lead to a reduction in deaths among our unhoused community members. Of course, as a result of our need to refocus efforts and resources on containing the pandemic, this session never took place. I'm going to look to all of you now and over the next couple of weeks to see what you would like to address in 2021. How would you like us to best use our time together to talk about the issues that are most important to our county? We can certainly recalendar the third session from last year. We can also take up new topics that have arisen over the extraordinary experience that was 2020. One of the topics that would particularly interest me is how the expanded pretrial releases and reductions in inmate population have impacted public safety. I would like us to not presume that we must or even should return to pre-pandemic carceral patterns if we have learned that they do not substantially improve public safety. So with that, Yvonne Jimenez, my team member, is going to reach out to all of you in the next couple of days to solicit your study session suggestions, and we'll then send out a list of all of the suggestions for each of you to select your top 3. Members of the public are also welcome to send suggestions. You can email them to Yvonne Jimenez, YVONNE.JIMEMEZ J-I-M-E-N-E-Z,
N-E-Z.
J-I-M-E-N-E-Z at bos.scc.gov.org. And I want to thank all of you, all of my colleagues on the screen today for your willingness to continue to dive a little deeper into ways in which we can better achieve our mission of serving and caring for every resident of Santa Clara County. Are there any comments on this item now or public speakers on item 9?
We do not have any speakers in the queue.
Okay, thank you. In the absence of seeing any comments, we'll move on to item 10, which is announcements. I'll begin, and anyone that has an announcement that they'd like to make, please raise your blue hand.
This is item 8, Madam Chair.
I'm sorry?
This is item 8, not 10, correct?
Is it? Sure is. Thank you very much.
Sure.
So to begin, on Sunday, January 31st, both District Attorney Rosen and I will be participating in a jubilee on a panel for criminal justice reform in Santa Clara County. The event is open to the public, and if you're interested in joining us, Allison Brunner will also be on the panel, who's the Executive Director of the Public Law Foundation. I will be posting links to that, to register to that event on my social media channels. Welcome to the new year, everyone. The second announcement is that the NACO, the National Association of Counties Criminal Justice Subcommittee, on which I sit, is planning to coordinate a national town hall on public safety. The details for that are not set yet, but once I know more, I will share links and information with all of this committee. Do we have announcements from other members? I am now looking for raised hands.
No, ma'am.
Don't see any. And Supervisor Wasserman, do you have any announcements for us?
Nope.
All right, then with that, we will adjourn this meeting to February 4th at 2 p.m. Thank you so much, everyone. Happy, healthy New Year.
Thank you. Happy New Year.
Thank you. Happy New Year, everybody. Stay
Happy
well.
New Year, everyone.
Thank you. Happy New Year, everyone.